take this question to Onyedikachi in Port Harcourt. How much of policy intervention can we apply to solving all of these issues?
Okay, there are a lot of policy interventions that are currently going on. The Coordinating Minister of Health and Social Welfare has graced the screen of various media houses talking about the maternal and neonatal mortality innovation initiative. That's MAMI. It was launched at the Joint Annual Review, November 2024, and implementation kicked off January this year. And it's under that initiative that there is provisions for free cesarean sessions for women, depending on the cause and the history of their pregnancy. And the initiative is also trying to strengthen referrals between the basic facilities where the BMONC, where women in the rural and underserved regions access care, the referral from those facilities to secondary facilities, or the ones that are called the CMONC facilities. So efforts exist in all ramifications. Efforts exist, but is it enough? The health system is still largely underfunded. The referral system is still weak. There are provisions to make emergency transport system available and more accessible, but how effective in terms of implementation is this taking place at these rural settings? And there's still a wide gap between policy and implementation. So it's a complex web of challenges, and it requires concerted efforts from, government, healthcare providers, communities, and even individuals. We cannot also talk about maternal health without talking about addressing the social determinants of health, poverty, and education. An educated woman, in fact, if you look at the indices on the Nigeria Demographic Health Survey, you would see that women, or in regions where women are having up to secondary education upwards, the maternal mortality rate is lower than in regions where women do not have any form of education. So education is already a very critical empowerment for a woman to seek information and know when to access care, where to access care, and also to make informed reproductive health decisions regarding family planning, regarding other reproductive health choices. So when we talk about policy implementations, policy interventions, yes, there are policy interventions. But is it enough? We need to talk about scale. We need to talk about coordination of these policies to achieve maternal health improvements in Nigeria.